Hi guys, um, this is Dr. T once more. So let's continue, guys, with our series on signs and symptoms um, that we expect from psychiatry patients. I hope you guys remember that we first spoke about speech abnormalities, and then we spoke about behavioral and motor, psychomotor activity abnormalities. We also spoke about mood and affect. So now we're going to be talking about features that are in line or that are related to psychosis. To psychosis. So for us to say a patient is psychotic, we need to have features that we're going to talk about now. So previously, someone who's got what I'm trying to say is someone who's got a mood abnormality, mood and affect abnormalities, they are not necessarily psychotic, not unless they've got a mood disorder and then with some features of psychosis. Then for instance, if they've got MDD, they've got features of MDD, it would be MDD with psychotic features. We can also have patients who just have pure anxiety related disorders, but they can also have psychotic features on top of that. So what I'm trying to explain is that this is the very first time we're going to be talking about features of psychosis, but we have been talking about psychiatry, but now we're going to be talking about features of psychosis. What I'm trying to really get you guys to understand is that not all patients that are not all psychiatry patients are psychotic. This is going to be the very first time we're going to be talking about signs and symptoms of psychosis. So the features of psychosis that we're going to be talking about. So what is psychosis? Psychosis, if we can just describe it, carelessly, this is a person who cannot distinguish between reality and fantasy. Reality. So this person cannot actually make a differentiation from what is just a fantasy or from what is reality. This is just a careless definition. I know there are definitions that are even half a page long, but just to make things very simple, that's the definition that we're going to be using. So at what point do we suspect what features must a patient have in order for us to say this person has lost touch with the reality? So there are three categories or three groups of these symptoms or signs. So they've got disordered thought form. It's number one. Disordered thought form. Disordered thought form. this is basically how we think. This is how we think. So they've got a disordered thought form, forming thoughts, how we think. So they've got a disordered thought form, and that thought form manifests as a disorganized speech. It manifests, this is how we say it. It manifests as disorganized speech. When someone has got a thought form disorder, you cannot open their brains and check and see, oh, you've got a thought form disorder. We can't do that. It's not possible to do that. So the way we diagnose it, the way we pick it up, is through their disorganized speech. So what are the examples of a disorganized speech? So how we think. I'll just use a different marker. Thought form disorder. So when we are this is how we are supposed to think. This is how we are supposed to be thinking. It's like straight to the point. So what we are thinking, when, for instance, you ask me a question, I would give it some thought and I will structure how I'm going to answer you. Because I don't have a thought form disorder, so I'll be straight to the point. And to see that my thoughts, there's nothing wrong with my thoughts, you will see it by in the manner in which I answer you. If, for instance, let's say you ask me, did you eat today? Yes, I ate today. I actually had bread. I had butter, I had coffee. This is from here to here. But if when you ask me a question, did you eat today? I say, today I woke up, I made my bed, and then I took a shower, and then after that, that's when I made breakfast. I made eggs. So that person is answering you, but is starting with other unnecessary information. But at the end of the day, they do answer your question. This is what they call circumstantial. Or circumstantiality. Maybe you ask another person, did you eat today? And then they're like, oh, today, you know what? I woke up, I made a sandwich. and I also made coffee. Actually, my neighbor yesterday, we had an argument. So this person started well answering, but at some point they drifted away from your answer. They moved away from answering you completely. This is derailment. This is derailment. Or let's say you pose the same question to someone else now. You ask them, what did you have for breakfast? And then they're like, okay, this morning when I woke up, I actually felt like I wanted to eat something nice. So I went to the shops, I bought myself a pizza and a cold drink. You know what? Just before I could eat, there's this thing that was playing on the radio, and then that thing, and then now they were answering you. It was playing on the radio, and I really loved it. And hey, that song, I don't know, the artist, they started by trying to answer you, and when they were very close to finishing, they did that. That's called being tangential. Tangentiality. So there are different examples for thought form disorders. There are different examples. What are the examples? Okay, let's say you ask the same question to another person. And did you have breakfast this morning? What did you have for breakfast this morning? Oh, okay. I made eggs. I made a sandwich, and then I also made coffee, and then and then they keep quiet. They just don't know what to say again. That's a thought block. That's a thought block. So I said this is normal. This is normal. Maybe I should just try and use. Do I have a different marker here? Different color. Sorry about that. This is normal, circumstantial, derailment, tangentiality, thought block. You can ask the same question. What did you have for breakfast this morning? That accident yesterday. It was so bad. There were people flying. Hey, that accident. That person didn't start answering you. That's like inappropriate. They are sure that they are answering you. You might even find that there was not even an accident that took place. That's just inappropriate. Inappropriate. These are thought form disorders, guys. Thought form disorders, and they are a feature of psychosis. We are going to talk about others. So this can be inappropriate or irrelevant. You can use inappropriate or just irrelevant. Irrelevant. And then you can still ask the same question to another person, and then they answer you in patches. This is flight of ideas. Flight of ideas. Okay, this is the first part, guys. Disorders of thought form disorders. So now the next thing that we're going to be talking about, let me just look at my time there. Let me leave this, cut it, and make another one. Don't want long videos. So thank you guys for watching.